Good day, this is Professor Will, CBMD PhD, and today's Wednesday, March 16th, 2022. It is 6:00 and 50 seconds, a.m. Eastern Standard Time. Today's research, overactive bladder. So let's hop to it here. Overactive bladder and urinary incontinence worsen with age. New study suggests association between age and menopause, status with increased urinary symptoms. Date December 15, 2021. Source, the North American Menopause Society. If you are feeling more sudden urges to run to the bathroom as you age, you are not alone. A new study suggests postmenopausal women aged 45 to 54 years are more likely to have overactive bladder syndrome. Additionally, obesity at multiple births puts a woman at greater risk for stress urinary incontinence. Urinary incontinence symptoms are common in women and typically worsen as women age. In the United States, the prevalence of urinary incontinence is 17.1% in women aged 20 years or older and 38% in women aged 60 years and older. There are two main types of urinary incontinence: urinary urge incontinence and urinary urge incontinence is defined as the involuntary loss of urine associated with the urge to urinate. The stress urinary incontinence, in contrast, is the involuntary loss of urine because of effort or physical exertion, including sporting activities, sneezing, and coughing. Of the two, women are more likely to be diagnosed with stress urinary incontinence. Overactive bladder syndrome is characterized by urinary urgency and is usually accompanied by increased daytime frequency and/or nocturia with urinary incontinence. Multiple studies have been conducted on these urinary issues that can adversely affect a woman's quality of life. However, this is the largest known study with data for more than 12,000 women. The goal of this study was to investigate the prevalence and factors associated with urinary symptoms. Although the study showed a significant association of overactive bladder in women aged 45 to 54 years and postmenopausal status, it also demonstrated that stress urinary incontinence symptoms may likely become less frequent after menopause. The stress urinary incontinence symptoms, however, were shown to increase as a result of a high body mass index and the number of times a woman has given birth. Other factors studied, including smoking status, history of diabetes, hysterectomy, and the use of hormone therapy. The researchers suggest that additional studies should be conducted to consider the association between time since menopause and overactive bladder symptoms in the perimenopause period. And this study underscores how common urinary incontinence is in women, with nearly 1 in 5 Japanese women reporting urinary incontinence related to overactive bladder or stress urinary incontinence in the last month. Midlife women were particularly affected by stress urinary incontinence, 18.2% in women aged 50 to 54 years. Given the significant negative effect on quality of life and the presence of effective strategies for management of these burdensome symptoms, the clinicians should routinely ask women about urinary incontinence. Good day, this is Professor Will, CBMD PhD, on microbiology, bioinformatics, and pathophysiology. This video was created for educational purposes only. Hope you enjoyed listening. Until next time, have a great day.